Thank you for joining us tonight. I'm Dustin Lukey. Healthcare workers continue to call for people to prevent ending up in a healthcare facility due to COVID-19. Gunderson Health System noting today of the 40 to 50 COVID patients they're treating, more than 80% have not gotten a vaccine, despite that vaccine arriving in the community 1 year ago today. News 19's Joe Minnie shares reflections from the medical community as they look ahead to the long road they still face.
A year ago this week, COVID-19 vaccines arrived in the Cooley region. Gunderson Health System doctors lined up to be the first to be vaccinated.
The preceding few months in which we had experienced so much death and so much sadness and despair as a community and my patients and their families, and knowing and the hope and the optimism with that vaccine, I felt so incredibly honored to be the first one to receive the vaccine in the system.
Mayo Clinic Health System prepared for inoculations as well, despite knowing few details initially.
We didn't know when it would arrive, who would bring it, how much would we get, what is it? We had pictures of what it would look like, but what is it really? How do we really do this? So there was a lot of unknown.
After a year of dealing with patients suffering from the virus, healthcare providers were anxious to get ahead of it.
Leading up to the first week that we were administering vaccines, I said the vaccines are a critically important tool to transition between being a pandemic to shifting into becoming more endemic or epidemic.
Seeing successful results, encouraging others to get the shot became a priority.
I watched firsthand these outbreaks in the facilities. The vaccine came, and within weeks, we saw a huge decrease in the number of outbreaks and in deaths. And in fact, last summer, things started to feel a little bit more normal.
It doesn't necessarily matter what vaccine it is. Vaccines work.
But vaccines are just one tool in finally getting the pandemic under control.
They have to be employed and incorporated with the other strategies, testing, masking, and everybody kind of doing their part and moving in the same direction. And that's where we've struggled the most, obviously, with the response to the pandemic.
Staying positive and working together, the next 12 months could be even more successful. In La Crosse, I'm Joe Minnie, News 19.
And Wisconsin state health officials issued an advisory this week urging people to layer those protections, vaccines, masks, and testing as they expect the Omicron variant, now identified in the state, to cause a rapid increase in activity.